Hello everybody, it's Brenda. I'm here today to talk about something we don't usually talk about. It is our health. And the one thing in particular I'd like to talk about today is coronary artery disease. Coronary artery disease, also known as CAD, is it involves reduction of the blood flow to the heart muscle due to buildup of plaque in the arteries or the heart. It is the most common cardiovascular disease. Types include stable angina, unstable angina, and sudden cardiac death. A common symptom is chest pain or discomfort, which may travel in the shoulder, the back of the neck, or the jaw, or occasionally it may feel like heartburn. Usually symptoms occur with excuse of emotional stress, and less than a few minutes improve with rest. Shortness of breath also may occur as a sign of a heart attack, and complications due to heart failure is an abnormal heartbeat. Risk factors includes high blood pressure, smoking, diabetes, excessive obesity, high blood cholesterol, poor diet, depression, excessive alcohol. A number of tests may help with the diagnosis of this, including electric cardiogram, stress testing, coronary computer technology, angiography, and coronary angiogram. Ways to reduce CAD risk include eating a healthy diet, regularly exercising, maintaining a healthy weight goal, and not smoking or taking medications for diabetes. High cholesterol or high blood pressure are sometimes a cause. This is limited advice, screening people who are at low risk and do not have symptoms. Treatments involve some of the measures as preventions. Also, medications such as antiplatelets, beta blockers, or nitroglycerin are recommended, such as procedures coronary involved or coronary artery bypass surgery. But anyway, I would like to share with you that what happened to me. I was having chest pains in the back of my shoulders, and the way that I explained it, the doctors didn't take me seriously. They said it was a muscular problem, and they sent me home. So I went home, and I began to feel the tightness and the pain between my shoulder blades. Well, I went to the hospital, another hospital in a different county, and they said, well, we're going to get you a cardiologist over here to check you out. So the cardiologist checked me out and did a stress test. It said that I had a blockage in my artery. It was an artery in the front of my heart. But anyway, the other hospital misdiagnosed me because my symptoms weren't strong enough, or they just didn't want to bother with me. But if you ever get any pains in your chest or in your back, most of my pain was in my back. So anyway, after all that, I went to this hospital, which they took me up to another heart hospital, and they did a heart cath, and they found out that I had a 96% blockage in the artery in the front of my heart. Is ACD or something like that. I don't know, if I don't remember now. But anyway, as a result of this pushing for testing, I found out that I had coronary artery disease, which you can live with if it's caught in time. But if somebody tells you your symptoms, you don't have the symptoms of that, keep pushing. keep pushing for tests. Because in a woman, especially because of the way their body is made, you can't always explain where the pain is exactly. And they just look at me. Even when I got to the big hospital, they told me that it's not heart related. And then when they got in there, they figured out it was. So that is my experience with cardiac or coronary artery disease. You can live with it. It can be controlled by medicine. It can be controlled by diet. But the worst thing in the world for this is stress. Stress can do a lot to our body, so don't sweat the small stuff. Life is too short. Just push on and just keep on moving. When something upsets us, don't worry about it. Life is really too short. Thank you for listening to my experience. I will be back on YouTube soon as I can get the breath. Because you can tell I'm a little out of breath now. But anyway, I miss all my YouTube subscribers. So until I come back, thank you for listening. Bye.